Cystic Fibrosis by Nicole Robbins for the Survey of Human Disease course at the Mississippi University for Women. Introduction. Cystic fibrosis is classified by the ICD-10 number E84 and characterized by excessive mucus production resulting in respiratory, infection, and pancreatic obstruction. The cystic fibrosis transmembrane conductance regulator is the defective gene that causes cystic fibrosis and discovered in 1989. This image shows the different organs affected by cystic fibrosis, such as the sinuses, lungs, skin, liver, pancreas, intestines, and the reproductive organs. Epidemiology and the geographic distributions and high-risk groups of cystic fibrosis. CF-affected population is relatively homogeneous and predominantly of European origin. Below are the incidence ratios among Caucasians, African Americans, and Asian Americans. In the U.S., it is said that there are more than 10 million gene carriers of the cystic fibrosis defective gene. There is a higher mortality rate for women when compared to men for those affected with CF. Both parents need to possess the CFTR gene to pass it on to their offspring, and in that case there is only a 25% chance that a child would develop CF. Risk factors displayed between genders were relatively equal, except there were many differences in pulmonary functioning. This image is a simple representation of both parents having the defective gene that causes CF and the 25% chance of it being passed on to an offspring. Epidemiology and time trends of CF. Over the years, there has been an improved survival age of those affected. Currently, the survival age is approaching 40 years. The earlier the diagnosis, the better, to live a more happy and healthful life. There are prenatal and newborn diagnosis available. This figure shows the improving median survival age of those affected with cystic fibrosis, and as of 2008, the median survival age was between 36 and 40 years old for those affected. Cystic fibrosis-related diabetes. CFRD is caused by insulin insufficiency, which is not enough insulin. Insulin is a hormone that helps your body use food nutrients and allowing your cells to get all the energy from carbohydrates, proteins, and fat in the food you eat. Insulin is made by the pancreas in special cells called beta cells. Cystic fibrosis blocks pancreatic ducts, which will then lead to the insulin deficiency. CFRD can then impact pulmonary functioning. Signs and symptoms of cystic fibrosis. According to the American Lung Association, here are the common signs and symptoms of CF. Salty tasting skin, persistent coughing, greasy and bulky stools, wheezing, loss of breath, and compromised appetite, which will then lead to issues with weight gain. Mucus buildup within the airways and the lungs is a perfect breeding ground for bacteria, which can then lead to infection. Susceptibility is then increased for those with CF to sinus infections, bronchitis, and pneumonia. The digestive system is also compromised because the release of pancreatic enzymes is prevented, which then limits the breakdown of food and the absorption of nutrients we need to sustain our organs functioning. Diagnosis of CF. There are blood tests available during prenatal and newborn stages to detect the CFTR gene and the functioning of the pancreas. Pregnant women, especially those who have a family history of CF, can choose to have a CF carrier blood test done. Sweat tests are then done later in life to measure the amount of salt in the sweat, which a high amount of salt in the sweat will lead to a CF diagnosis. Additional testing could include genetic testing, chest and sinus x-rays, sputum cultures, and lung functioning tests. If a parent It is important to take your child to a doctor if he or she has a mucus cough, repeated sinus or lung infections, frequent and foul-smelling stools, rectal prolapse, or growth problems. As a diagnosis tool, all 50 states are now required to do newborn CF screening. The earlier the diagnosis, the increased chances of a longer, more fulfilling life. Risk factors of cystic fibrosis. Cystic fibrosis is an inherited disease which is based on family genetics and history. A CF gene is defective if a child inherits two abnormal genes, one from each parent. A parent can be a carrier of CF and not have the disease itself. Multiple strains of the CFTR gene are known, which will have varying effects and severity. Race and family history are not an automatic diagnosis of CF. Protective factors of cystic fibrosis. CF risk factors are non-modifiable and uncontrollable. Race and genetics would not be considered protective factors. Even though they are not an automatic diagnosis, they do contribute to susceptibility. Protective factors or actions after diagnosis include appropriate treatment, nutrition, and prevention of infection. Monetary costs of cystic fibrosis. Medical costs vary by treatment type, frequency, and technological advances, and insurance type. The Cystic Fibrosis Foundation has found that 97% of people with CF are insured. However, a survey in 2009 shows that out-of-pocket costs and premiums have increased to 20%, 14% of CF individuals have reached the insurance annual limit, and 3% of individuals have reached a lifetime insurance limit. The same study in 2009 also found some very alarming statistics, such as 27% of CF victims purposely skip or lessen medicine dosage, and 21% skip or delay doctor's appointments and/or procedures. Costs are associated with prescription medication, hospital stays, follow-up medical visits, and screening or tests. A study conducted in 1996 found the annual medical cost range for those with CF ranged between $13,300 and $62,000. Those were from 47% hospitalization, 18% of DNAs, which is a medication to thin and liquefy mucus, 12% clinic visits, and 10% outpatient antibiotics. Of those affected with CF, 56% have a mild form, 28% of moderate form, and 16% of a severe form. Emotional costs of cystic fibrosis. CF can lead to emotional consequences such as depression, anxiety, stress, and fear. There are certain outlets to seek professional help such as therapy, medication, support groups, and support from family and friends is always a benefit. Health costs of cystic fibrosis. CF can compromise the remaining health of those affected. Helpful lifestyle changes according to the American Lung Association include hand washing, avoiding contact with those who are ill, avoid smoking and secondhand smoke, and receive the flu shot annually. Also, children and adults with CF may need a high-calorie, high-fat diet to make up for the improper absorption of nutrients caused by the disease. You may also need pancreatic enzyme supplements and vitamin and mineral supplements. Treatment of cystic fibrosis. Sadly, there is still no known cure for CF. Palliative care is needed to minimize pain, discomfort, and increase normality of daily living. There are currently multiple therapeutic methods to maintain a healthful status which can be done solo or in combination and vary based on individual severity and age. Here are some examples of CF therapy, which include airway clearance techniques, inhaled medications such as saline solutions or antibiotics, implanted devices which allow regular administration of medicine, and nutrition, which includes enzyme supplementation. It is also important to add physical therapy and breathing exercises to a therapy regimen. Anti-inflammatory medications can also reduce inflammation in the airways and lessen discomfort. In severe cases, lung transplantation may be required. Lung transplants have been 90% effective for a 1-year survival, but then drops to 50% over a 5-year survival period. Future therapy of CF may include gene therapy, which would be introducing a normal copy of the defective gene and repair gene function. Gene therapy is considered a possible future cure for CF. Resources for cystic fibrosis include financial assistance programs such as the Cystic Fibrosis Patient Assistance Foundation, which is a nonprofit organization that provides financial assistance to cystic fibrosis patients who need FDA-approved medication or paired drug delivery devices for nebulized treatment. Eligibility for this program is a diagnosis of CF, permanent U.S. resident, request for medication or device, meet qualifying income criteria, and have applied or been turned down from other programs. Other resources include financial aid and scholarships, such as the Cystic Fibrosis Scholarship Foundation, the AbbVie CF Scholarship, and the Elizabeth Nash Foundation Scholarship for those looking to go to college and need tuition assistance. The Cystic Fibrosis Research Incorporated is a nonprofit organization that provides research, resources, fundraising, and financial assistance since 1975. Their variety of resources for the CF community include the Epocrates Med Search Engine, list of assistance programs by state, CFRI live webcasts, CFRI News newsletters, and additional publications and informational DVDs and CDs. Prevention of cystic fibrosis. The medical community is currently devoting considerable attention and resources to personalized predictive medicine, the identification of genetic markers that make a particular individual susceptible to a specific illness or disability, with the ultimate goal of tailoring therapies to individual patients. There are currently no means of primary prevention for CF. The uncontrollable and unmodifiable risk factors eliminate any possibility for primary prevention. CF screening and early diagnosis will aid in appropriate treatment regimens and therapies. Secondary prevention is preventative actions taken once a diagnosis is made and what can be done to avoid further damage. Treatment therapies already discussed will be methods of secondary prevention, and other prevention methods of common viral and bacterial infections would then prevent the further deterioration of lung function. Future secondary prevention methods would hopefully be gene therapy. Tertiary prevention of CF vary based on severity, age, and secondary complications caused by the CF. The time of diagnosis, condition, and age can impact the health and quality of life of those with CF. Lung transplantation does not necessarily clear the CF from the body, but provides a healthier lung or set of lungs for improved respiratory health. It is important to continue current methods and treatments for CF. There have been momentous advancements within the scientific and medical world which have helped improve the average lifespan for those affected with CF. There was a time where a CF individual wouldn't live past 6 months, and now they're able to live to around 35 to 40 years. These advancements have also increased the quality of life and helped minimize discomfort. However, the medical world is still trying to find a cure to help those who continue to suffer from cystic fibrosis. The upcoming slides are my list of references. Hope you enjoyed my presentation. Thanks for watching.